Feeling comfortable in your own skin is very important, and that's why many women choose to have breast augmentations. Joining me now is plastic surgeon Dr. Beth Collins. Nice to have you back here,
Hi,
Beth.
Teresa. How are you?
I'm great. You've brought some samples here.
Yeah, today I brought some things for you to play with.
First, let's talk about what exactly a breast augmentation is.
It's just simply making the breast larger. So we use these devices to put underneath the breast, either under the muscle or under the breast itself, and that's the kind of thing I decide in a consultation where it's going to go. And it just augments the breast, gives you a little extra volume there. So it's a really nice, pretty easy procedure.
With good results?
Of course, excellent results.
You've brought some different, we're looking at different things here. Why don't you explain what's on the table, doctor?
So a while back in the 90s, we used to always use saline implants here in this country. In Europe, they were using silicone implants, which are far more natural. So I wanted to bring these to you to show you the difference, because the silicone implants are really a much more natural feeling.
Now, I can't imagine anyone would even want this.
Right.
It doesn't seem like it would really feel natural.
It's nice, and that is true. That is the trend today, that people are going more toward the silicone implants. And the reason for that, it is obviously a more natural feeling. You could tell the difference.
Well, and the original reason behind it was if it had ruptured, it would be safer. Is that correct?
There was some bad press that wasn't true about the silicone, and throughout the time that it was there, that it was going on, they were using them in Europe with no ill effect. So they were put back in on the market and have been tested by the FDA and found to be completely safe. So yeah, I'm very happy to recommend those. If I had a family member who was getting a breast augmentation, I would recommend a silicone implant, and they're very safe.
Sure. So let's talk about the initial meeting. You have a patient that comes to you and says, hey, I'd like to increase my bust size.
Yeah, so we have a nice frank discussion about it. I like to see what their goals are, what they are at right now, and then what their goals are going to be, and we decide about what size they're going to be. And that's why I brought these, because this is the most important decision in the breast augmentation, is what size you're going to go to. And I always like to put it like it's like buying a pair of pants. You want to get something that's going to fit your body. You don't want something too small, and you don't want something too big.
And how do you determine that? Is it just...
So these are nice little devices that are made. This is obviously a very large one, but they fit over the breast, and you could put them a bra on and then your shirt and try them out. So somebody might come in and try something like this, so that at the end of the consultation, we'll be able to know the exact volume and they will have tried it out in their clothes and their bra, and they'll be able to see exactly what looks good for them. So we know going into the surgery what it's going to basically look like at the end. It's a very useful tool. So,
well, let's talk about the surgery itself. There are different ways that these can be implanted. Let's talk about I mean, some have bigger scars than others, would you say, or?
No, the scar is very small. It's 3 centimeters, and I typically recommend people putting it underneath the breast in the inframammary crease, this little fold underneath the breast, because it has the best results. There are other ways to put them in. You can make incision around the nipple part of the breast or under the arm. So those are also viable ways to do it. But it's about an hour in the operating room, and the recovery is very quick. I have people who have been out and doing things the very next day.
Really?
I say you could be a little bit sore for about a week after, and I like you to take it easy for 2 or 3 weeks. I try to get people not to do any heavy lifting or vigorous gym activity.
Sure.
But the recovery is very nice. You're certainly out and about and doing things. It's not a debilitating operation by any means, and not really even very painful. So. So it's a good option, and I do find that people start to want to do the procedure about right now.
Is that right?
Yeah.
After bikini season?
Right. Well, I think the reason is people don't want to have surgery during the summer, and so they are starting to come in. And this is a great time, especially if you don't want people to know you've had it done, because we're getting into the bulky sweater season, so you could do it and hide it for a little while and kind of gradually ease your way back into.
Dr. Beth, who are your typical patients? Who's having this procedure done, would you say?
Oh, such a range. I mean, I have a range of ages, young girls from age you have to be over 22 actually to
Okay.
be able to get a silicone breast implant, and so certainly somebody over the age of 22 could make their own decisions on up. I have even had ladies who are in their 50s and 60s getting breast augmentation. So usually it's somebody who's just a little bit dissatisfied with the shape of their body and they want to be a little bit more proportional.
Sure. Let's talk about the safety of this, because even if it does rupture, it's not going to harm your body.
No. So your body forms a protective capsule around that. It's very thin, but what it does is it contains everything. If that were to rupture, it wouldn't seep out into your body or get into your bloodstream. It stays right where it is.
Got it.
If it does rupture, and the rupture rate is not high at all, but if it were to rupture, we would recommend taking it out and replacing it, but it doesn't have any ill effects or harm to you.
And I think it's also important to mention to our viewers that you're still able to breastfeed if that's something you needed to do.
Absolutely. And that is a common question because there are a lot of young women who are doing this procedure. So yes, it's safe for the baby and you are able to breastfeed. It shouldn't interfere with that at all.
Very good. Dr. Beth Collins, thanks for bringing the samples and explaining everything for us.
You're welcome. Good to see you.
And of course, give us your website one more time.
It's BethCollinsMD.com, and I just put a bunch of new pictures of breast augmentation, which I can't put on TV today, but they're right there on the website.
We like the before and afters.
Yeah.
We'll check them out, and you're located at 2614 Boston Post Road in Guilford. Always a pleasure.
All right, thanks, Kate.
Up next, we're putting a new spin on your summer salad when style returns. We'll be right back. But first, take a look at this.